Hello, it's Friday, May 12th, and it must be time for another legislative update from your North Carolina Medical Society. We're recording this one early. It's actually Thursday, but we've got a little break before the Senate goes in for voting on the budget, so we thought we'd go ahead and take the time to record this and give you an update on what we expect to be passed tonight, late into the hours, in the Senate budget. It's been great this year. We don't have a budget that is highly offensive. There are not a lot of provisions in there that we're really concerned about. There are quite a few things related to health care. Out of the 349 pages of provisions, over 100 pages, something like 126 pages, refer to health care. So a lot of policy discussion by the Senate in this budget. But first and foremost, there are no Medicaid rate cuts. And this is something that we face time and time again for years. So we're very pleased that we're not facing another rate cut, especially in a year where money is tight because of the tax changes that they're looking at making. So very pleased about that. One concern that I'll bring up is related to Senate Bill 629. We talked to you in the last couple of weeks about those insurance changes, those transparency changes, and the effects that it would have on your contract negotiation because it would set a statutory rate into law. This budget includes some of the language from Senate Bill 629, including the notice provision, which is something that the insurance companies are currently responsible for. But it also includes some other language from Section 1 of 629 that goes well beyond just doctors giving notice to their patients about whether they're in network or out of network. So we still have some difficulty around that. We still have some discussion that needs to occur with that because we do not support that provision. But I wanted you to know about it so that as you're talking to your legislators, you can be doing the same thing that we're doing. We can talk about fair notice, that you are willing to talk to your patients about whether you're in network or out of network. That's a natural thing, but we're not looking at giving the insurance companies an advantage in the negotiation process with you during contracting, not in the statute. That's not something that we think is good. It's not good for healthcare. It's not good for the patient in the long run for them to have all the cards stacked against you going into those contract negotiations. There are dozens and dozens of other provisions. Like I said, more than 100 pages. You'll see some really great things like investments in rural and community health. You'll see a lot of language about the health information exchange and other topics. If you want to know more about all the other topics that are out there, go to our blog. We've been tweeting about these things over the last couple of days, so you've seen provisions probably already that we took pictures of and put out onto the internet. But you can see a complete rundown of all the different provisions that we think are the priority healthcare things on our blog, so go there and check it out. The other thing that I want to talk to you about today is the nurse bill. We've talked about this numerous times. You've done a great job communicating with your legislators about our opposition to this bill. We have heard that the chairs have decided to bring this bill up for discussion and vote on May the 24th. So in 2 weeks, your legislators are going to be deciding whether to support or oppose this bill, and we need your help to continue to talk to them about the problems that we have with nurse practitioners, all APRNs, becoming independent practitioners, and why we think supervision is the right way to go, why we should keep physician supervision in place. We'll be making sure that you have an action alert to do that, but many of you are well schooled up in having that conversation without us providing tools for you, so make sure that you're doing that as your legislators are home this weekend, resting up for another week down at the General Assembly next week. We're on day 67 of the legislative session. We still have another probably 6 or 8 weeks to go. So be sure to continue to stay in regular conversation with your legislators and know that you're continuing to watch, you're interested in what they're doing, so that they'll be sure to think about your concerns when they're voting on those bills. Until we talk to you next week, have a great one and take care.